Now patient is showing an eruption of this kind. What is this called? It is called pellagra-like eruption. Which drug lead to pellagra-like eruption? If TB drug is there, what is the answer? TB drug is the answer. TB is there, TB is the answer. So INH is what you need to remember. Then what do you have? This is looking like acne. Acneiform eruption. So what is the most common cause of acneiform eruption in India? In India, जब भारत की बात होता है टीबी होता है, टीबी के बात होते INH होता है. So that is the answer. Ramu, a 13-year-old, is having lesion like this. All his class girls are avoiding Ramu, and Ramu is losing prospective girlfriend, first girlfriend in the life, being stolen away by a skin lesion is too much, doctor. Remaining part of life, it can happen, okay. She can be able to tolerate it. So a lot of times, a ignorant layman science teacher will tell, no, Ramu has TB, leprosy, don't go closer to him. Because she read in the newspaper or in a TV that anything that looks white is leprosy. So, pityriasis alba, it comes with the onset of puberty and it goes away the moment you enter medical college. The teenage is being stolen out. So, pityriasis alba. So, what is a true statement about it? Do you have dry skin over there? Yes. It is atopic etiology. It is non-scaly macule. It is not due to nutritional deficiency. Lot of time two things will be mistaken for such white lesions on the skin in a young boy. Is he not being well fed or leprosy? It is neither of that. It will go away the moment Ramu has passed through lots and lots of puberty crawling on him, is what you need to remember. Now doctor, a patient who is 55-year-old presents with these superficial ulcerations which are also involving oral. What is the only thing possible? Pemphigus vulgaris. So how do you differentiate pemphigus vulgaris, which are from bullous pemphigoid, which are flaccid, etc., you must be quite sure. So row of tombstones appearance histologically is a feature, fish net pattern and IgG deposition if you do immunofluorescence into the dermoepidermal junctions is also seen, but not IgA. Now a radiograph has been given to you. What do you see in this radiograph? Already we are putting a couple of pointers to direct you towards there. Retrocardiac area may, there is an increased opacity which occur in the left lower lobe lung consolidation, will lead to retrocardiac prominence of the shadow. Second, the diaphragm, here you can see the diaphragm clearly. Here there is a loss of diaphragmatic silhouette. So loss of the diaphragmatic silhouette means it points to which lobe anatomically? Lower lobe is what you have to, left lower lobe pathology is what you need to basically look for. Now what is this radiological appearance which is being shown to you is because of? Two things have been shown to you. What do you see? Millet seeds like nodules. Similarly on the X-ray also, actually this X-ray may not be that clear. What you have is miliary appearance, miliary pattern. So what are the causes for the miliary pattern? Let us be sure. Sarcoidosis, tuberculosis, pneumoconiosis, but not pneumocystis carnii is what I want to underscore. Then what is this radiological appearance? It looks like the sun is rising. So rising sun appearance is a feature of hydatid cyst is what I want to tell you. Now what is this radiological sign in the CT is trying to do? There is a fluid here. This fluid can be ascites or this fluid can be pleural effusion. How do you differentiate the two? If the effusion is the fluid, then effusion, pleural effusion, what will it do? Pleural effusion can collect in the posterior aspect because pleura will descend down now, posterior aspect. So it can come close to vertebra, posteriorly. And the effusion, what can it do? The crust of diaphragm will be there, no? It will push the diaphragm laterally. See, this diaphragm is there, no? This is being pushed laterally, crust of diaphragm, by the fluid collected over here in the posterior aspect, which points that this effusion is, this fluid is pleural effusion but not ascites. There will be 4 radiological signs that differentiate ascites from pleural effusion on CT. Okay, so pleural effusion and ascites differentiation is what you say, it's called displaced crust sign on CT is what I want to tell you. We have discussed this in a more greater detail in our chest radiology, which is available in the anatomy2medicine.com video library. So please review chest radiology. 200 common questions in chest radiology. We also discussed neuroradiology. Totally 30 hours we will finish all radiology. That indirectly revises medicine, surgery, everything. So please take opportunity to revise those content. Then doctor, in a child this radiograph is shown. What is this structure which is triangular in shape like a sail? What is sail? A boat is there, no doctor? On the boat, you remember we used to all do drawing, no, in the childhood. Huh? So, sail. Any sail shaped structure which is triangular in the mediastinum in a child is what? Thymus. There are 2 important ways you will recognize thymus. One is sail sign, other is called wave sign. Anyway, I will be repeating what I already taught, which is available in the online video library. Review that in the chest radiology. Wave sign means when thymus enlarges, the ribs will lead to indentation on them. So that wavy pattern of the border of the shadow points that this is a thymus shadow, is what you need to basically remember. So it is absent in digeorge, it is triangular, bilobed, and it undergoes fatty involution with advancing age, is what you need to remember. 52-year-old is having a lesion in the area of his left flank. Obviously a dark colored, irregularly bordered lesion is being shown. What it should be in a PG medical entrance? Melanoma. And histology shows the presence of melanoma. So how do you want to basically treat it? We use basically interferon alpha for the management of malignant melanoma, is what need to be remembered. A 76-year-old from Tirupati has developed past 3 months pleuritic lesions on the trunk. Last time only we discussed this. How do the lesions look like? You took dung and stuck it on the wall. That is the nature of seborrheic keratosis. Any sudden appearance of such numerous seborrheic keratosis which were not there earlier, for example, in an elderly man, means think of malignancy. It is a cutaneous manifestation of internal malignancy, and that is called sign of lesser Trilach, is what you have to basically remember. So, malignancy. 68-year-old came with colicky pain, blah blah blah. Ultimately, image is showing Meckel's diverticulum. So, what is true thing about it? It is the most common congenital anomaly of the digestive tract, is what you need to remember. Now, a fatty liver is being shown to you. What kind of fatty liver is this? The fatty vacuoles are small. They are not like big vacuoles with a displaced nucleus, means it is macrovesicular. This is micro. So what is the drag that lead to the such a kind of appearance? So there are some 5-6 causes for microvesicular, 5-6 for macrovesicular. You must know the list of causes. Write it in your 200 pages notebook and go to the exam hall, doctor. A 64-year-old comes with annoying cough. Physical examination is remarkable. What do you see here? Left supraclavicular lymph node. And chest X-ray is being shown to you. What do you see here? A centrally located mass lesion. Two types of carcinoma lungs are central. SSC, squamous cell, small cell are central, is what you have to basically remember. And what is the typical finding that he is having? He is having sodium 120, which is low. A hyponatremia which is happening in somebody who has got a small cell carcinoma is because of SIAD, syndrome of inappropriate ADH production, is what you have to basically remember. Then doctor, 16-year-old girl who has got amenorrhea. So what is she having? Widely spaced nipples, and she is also having webbed neck, which is a feature of gonadal dysgenesis. Gonadal dysgenesis is because of what? Monosomy of X chromosome. Then what leads to development of malignancy in this clinical scenario? Whenever monosomy of X is there, if it is 46XX without any Y chromosome, it does not lead to malignancy of the streaky ovaries. But if mosaicism is there with at least one Y chromosome, then that is a strong predisposing factor for that streaky ovaries to undergo malignant transformation, is what you need to basically understand. A 30-year-old father of 3 children has presented, physical examination is being shown. What is it? Gynecomastia. So father of 3 children means actually he is not the mother of 3 children, father of 3 children. So what is the cause of the gynecomastia? It's a coincidental that he is the father of 3 children. So you should always, how do you evaluate gynecomastia? Always evaluate estradiol HCG levels, is very, very important. HCG levels in a man, why? Don't say. Why HCG levels in a man? Not because man becomes pregnant, but there can be a testicular carcinoma which is producing excess amount of HCG. That's the reason you should evaluate the estradiol and HCG. Then, what do you have this? In a 30-year-old presenting with a gradual decline in the mental function, you are having a mass lesion with a lot of significant edema which is surrounding. This is the classical histology of glioblastoma multiforme. And where do you find gliomas very commonly? Neurofibromatosis. That's the reason neurofibrin is the abnormal gene which is possible. 23-year-old from Bangalore presented with fever, ptosis, inflammation of the upper eyelid. And when you have done the neuroimaging, what you found? One side there is a thrombus of the cavernous sinus around the sella turcica. Right? So the question is, which clinical symptom of cavernous sinus thrombosis will be ipsilateral to the side where the thrombosis is there? The ptosis which you see. Why do you see ptosis in case of cavernous sinus thrombosis? Because of the involvement of the third cranial nerve. It will be ipsilateral in nature, is what need to be remembered. So ipsilateral ptosis along with the edema of the upper eyelid is a characteristic feature which you see in case of cavernous sinus thrombosis. With the palm flat on the table, a patient is being asked to move the middle finger sideways So what is this test called as? Igawa's test is what you need to remember, which test for the ulnar nerve. You know that dab pad. So you are testing dorsal interosseous when you are abducting the fingers. Adducting, you are using the palmar interosseous is what need to be remembered. Sri asked a very good question. Sir, it could be liver failure because of 3 children, which led to gynecomastia. Earlier case. Reason for? Let's go back. It's an interesting objection raised. We'll go back to the case history. "30-year-old, he does not use any drugs. Laboratory evaluation reveals that both LH and testosterone are low." Are we saying liver failure in him? We are not saying that. Then? You mean to say Sri ke baare mein? Oh, no, she didn't say liver failure due to 3 children. I'm adding up. So that's the point. So see, the protocol of evaluation of gynecomastia is what is the question here. Okay. Chalo. Now doctor, cavernous sinus thrombosis is over. Palm flat, Igawa test is over. No, ulnar nerve. Now what is this condition basically called? Genu varus or valgus? Genu valgum. Most common cause is idiopathic. It is a fracture of the lateral condyle so that the medial condyle continued to grow. अगर lateral condyle का fracture हो गया, it did not grow. Medial condyle continued to grow, and hence it became little longer, and that is the reason there is a development of genu valgum is what I want to underscore to all of you. Then doctor, what are these pins which are used in orthopedics? Fundamentally, you are having Kirschner wire, intermedullary nail, and steel wire. Kirschner wire as shown here is the one which is used for fixing the small bones, is what you need to basically remember. So all orthopedic gadgets, devices, everything, you must be kadak karena. Similarly, Das surgery के पीछे instruments and obstetrics Datta के पीछे instruments. You need to have a glimpse of the description of them. Luckily, medicine guys don't have many instruments. Medicine guys have more to talk. They themselves are an instrument, right? What is this lesion? Look everywhere, and finally you have a crack in the calcaneum, right? So, what are the common accompaniments of this calcaneal fracture? Fracture of cubic rami, compression fracture of the vertebral body, atlantoaxial. When will calcaneum fracture will occur? It is like the base of your existence getting broken down. Unless you jumped from a long distance that you got first rank in AIIMS, then only it will be broken. Along with that, what will God will also offer as a Dasara package? One atlantoaxial, one pubic ramus, one compression fracture. So there is a reason, don't jump if you don't get seat or if you get seat. Considering calcaneal fracture as a possibility. Now which is not a worker of Anganwadi worker. Anganwadi worker doesn't do sanitation. If you ask her to do sanitation, she will kill you. So she has her own plan of what to do. She can do non-formal education, immunization, etc. etc. Postcoital contraceptives does not include norgestrel, but OCP is RU486. Copper T also is placed. Postcoital contraception. 64-year-old from Tirupati is having hypertension. There is a skew deviation of the eyes along with ptosis, along with clumsiness and titubation of the head. Then what will you basically expect in this given case? So you must know lateral medullary syndrome of Wellenberg. What to be identified? There is a right-sided sensory loss. Hence we consider it as a left lateral medullary syndrome. Why? Why? Give me the board please. Typically in the brainstem, what do you have in brainstem? Midbrain, pons, medulla. So you are having ascending tracts and descending tracts. Descending is corticospinal tract, which will undergo decussation at the lower part of the medulla and go to opposite side. Then dorsal columns. Dorsal columns will ascend uncrossed until lower part of medulla, and here they will undergo the decussation and form medial lemniscus. Then what else do you have? You are having the spinothalamic tract. Already in the spinal cord only it got decussated and came. If medulla is medical college, corticospinal tract is a married medico. Before entering medical college only, she got married and entered into medical college. But dorsal column is not like that. It is a bachelor until entering husbandship. Then it got married and crossed at the level of medulla. So that is the reason, if the medulla get infarcted, the pain and temperature carried by the spinothalamic tract will be lost on the opposite side. So इसलिए कहाँ loss हुआ? Right sided sensory loss. मतलब कहाँ की medulla को दिक्कत हो गया? Left sided. That is how you will localize the lateral medullary syndrome, is what need to be remembered. Now doctor, 59-year-old from Mumbai had brain stroke following a vertebral artery dissection, developed dysphagia. What is it because of? Typically, the vertebral artery and the branches of the vertebrobasilar circulation will supply the brainstem. Okay, so what he is having is a problem in the vagus, which supplies ultimately his pharyngeal and laryngeal muscles motor supply. That's the reason he is having difficulty in deglutition, etc. So what is that motor nucleus of the vagus sitting in the medulla called as? Nucleus ambiguous is what need to be remembered. What are the three cranial nerve nuclei whose common nucleus is NTS? Nucleus tractus solitarius. N is 9th, T is 10th, S is 7th. For these three, 7th, 9th, 10th. Glossopharyngeal, facial, vagus. For these three, a common sensory nucleus in the brainstem is called as nucleus tractus solitarius, is what you need to remember. Neuroanatomy, brainstem का पक्का होना है. अगर नहीं है तो आज ही आप neuroanatomy in anatomy2medicine.com, brainstem, review it. These are all the topics, doctor. Either you read, understand, you listen, understand, but you understand and explain your friends who are preparing for entrance. You are able to explain your friends means you understood, right? But they are the ones which should not become a bottleneck when you go for entrance exam. Entrance exam preparation में 3 लेवल का होता है डॉक्टर. एक लेवल क्या होता है बोले तो पूरा MBBS में टाइम पास करके लास्ट मोमेंट में रिव्यू बुक्स, दिस नोट्स, दैट नोट्स पढ़ के फटफट एग्जाम जाके कुछ न कुछ लिख के सरप्राइज दैट दे आर नॉट इवन क्वालिफाइड or got 10,000 rank and feel remaining 9,999 were unreasonable fellows who for all of them paper was out. That is the reason I got 10,000. You will justify. एक लेवल का. सेकेंड लेवल का होता है you will do hard work. 5-6 months बैठ के पढ़ते हैं students, but unnecessary material which is not asked in exam also they start reading. Last moment when notification comes, they all get panicked and once more go through last few things and then make it messy in the exam hall. Second level ka. Third level, read what is going to definitely come in exam. Don't overread. Fill the gaps which you had in the MBBS 4.5 years, which are high yielding topics for entrance. For example, strabismus नहीं पढ़े ऑफ्थल्मोलॉजी में, अभी पढ़ो क्योंकि strabismus के ऊपर क्वेश्चन आता है. Every time you have a confusion about how to identify TB meningitis versus bacterial meningitis versus viral meningitis based on the CSF findings. अभी पढ़ो. अगर entire MBBS में you felt that it is a confusion, because that is going to come in exam. So they will consolidate the things before entrance only. They know they are going to be the top rankers. Maybe they guess that they will be in the 100 ranks. They are in the between 100 to 200. That's okay. That is the third level. I want you to go to the third level of ozone layer, and before exam only be sure this is my year of joining PG. Okay, and when will that point will come? If you know what you are reading precisely, and you yourself is the best person, doctor, to identify where is the missing factor. But lot of times we will go into a defense of not repairing those missing areas of our preparation. Suppose if we are not good in antiarrhythmics, we ourselves have to sit for 1 hour, just 1 hour, and decide how to smash that topic and bring it to reproducible level. That should happen. Okay, I hope you will all do that. And a good preparation is what? Always remember, tensionless preparation, anxiety non-provoking preparation, not an over-ambitious preparation, and the preparation that you really enjoy doing is the best preparation. Not only preparation, any aspect of life. What is a painful marriage? If you are afraid to go home, that is painful marriage. If you are afraid to pick up phone also, that is painful marriage. The one which you are enjoying, delivering it, is all any endeavor of life. If that is there or not is the first question. If it is not there, why it is, you need to revisit. But ultimately you need to revisit, sit, crack 300-400 hours of your time, invest on this. You will get a 1.5 crore worth of a MD seat. Okay, so that should be the goal of us, and we are in the process for the next 5-6 months. Anything you tell me, if it is not falling in line, we will be there to help you. That's the purpose of us. So 23-year-old describes recurrent memory problems. Her fiancé reports that she is inattentive for 3 minutes. Only 3 minutes is too small a time. There are fiancés who will be inattentive for about 6 months also. So what is she basically having? She is having a complex partial seizure without any secondary generalization. So for that the treatment would be carbamazepine is what you need to remember. 63-year-old progressive spastic paraparesis. He has an urgent continence, numbness in the right toes more than the left, and etc. etc. So what do you see here? A aneurysm on the top of the convergence of the, what is this vessel? Basilar artery dividing into posterior cerebral arteries. It's called basically the top of the basilar artery aneurysm, tip of the basilar artery aneurysm. MRI is the one which you need to basically do in this given case of progressive myelopathy is what you need to remember. Now, what lead to worsening of multiple sclerosis symptoms? Hot weather, stress, anything. A multiple sclerosis patient who is otherwise very stable suddenly lost her husband. There will be a sudden deterioration of her MS. Stress is what you need to basically identify. Then Uthoff's phenomena, which type of interferon is used in MS, where are the Dawson's fingers, 10-20 points on MS, हाथ में रहना. Then a 5-year-old head CT showing calcification in the cerebral cortex in a railroad track pattern. So this is called railroad track pattern. So what is this? Stooge-Weber syndrome is what need to be remembered. Munchausen is what? It's a factitious disorder where the mother creates a artificial fever by using a hot water milk bottle in her child to draw attention. Then paranoid delusions include reference, persecution, grandeur, but not nihilistic. Nihilistic delusion का मतलब क्या है? There is no entrance, no notification. This year they are going to give it just based on the money. So instead of preparing for entrance, better prepare for doing bank robbery. If your friend is telling all that in the reading room, you should think, oh, this fellow is suffering nihilistic delusion. So a form of psychotherapy in which a group of patients will come and take assigned role, and in doing so are able to gain insight into their own mental disturbances, is known as what? Is basically called psychodrama. Right? So if you get psychiatry, take it. Oh, very interesting subject. At least you will learn how to understand your spouse and live for next 50 years without walking out of the marriage. So psychodrama is what you should be very sure about. So psychocatharsis means what? You are a psychiatrist, your patient will lie on the couch and they keep on telling, oh, my school science teacher, he used to beat me blue and black. That is how he became a police officer and beating everybody blue and black. Underlying cause is the childhood conflict. Right there. So psychiatry that way is very interesting. Just you need not do any CPR or intubations, nothing. Just बैठ के उनके कहानी सुन के possible cause of the conflict identify करके उनको पता है तो oh, he is relieved of his psychological conflict, right? In fact, lot of times you will recognize tomorrow when you do MD also, you must know how to recognize why this professor is so tough to me. There will be 4 or 5 possible reasons. Maybe his wife is tough at his home, maybe his son is a drug addict. Where is the problem identify करके उसको correct करे तो he will be good with you. So that's how catharsis will help. Delirium and amnestic reaction can be seen with alcohol. Then Alzheimer's dementia, more common in females like Margaret Thatcher. Of course, Ronald Reagan also had it. Then inflammatory bowel disease refractory to medical treatment. So what do you want to basically do? If you happen to give total parenteral nutrition, then it will speed up the process of closure of the fistula in case of the Crohn's disease is what you need to know. Now a 54-year-old with colicky abdominal pain, and he has a history of melanoma that was resected from his arm, and his upper GI radiograph is being shown. What do you see? Here you see one part of the gut intruding into the other part, which is basically called intussusception. So you need to do exploratory laparotomy, manual reduction and resection of the involved segment is considered to be the management of choice. A 59-year-old woman undergone pelvic irradiation therapy for 7 years. Now she has a villous adenoma of the cecum, and her surgical wound is red and tender, and there is a drainage which is happening after anastomosis. Common underlying cause is the presence of anastomotic leakage with the enterocutaneous fistula, which is the underlying cause. Then coming to the appendix, it is the confluence of the cecal tinea which will help you to identify that, oh, this structure is appendix. Then coming to the pathogenesis of the appendicitis. In most of the causes of appendicitis, what is the underlying cause? It is the luminal obstruction due to bacterial overgrowth and secretion of mucus and increasing of the luminal pressure, which is causing the acute appendicitis. Then regarding the peritonitis, it is not multiple, single organism is most commonly seen in peritoneal dialysis catheter if you send it for culture. E. coli, Klebsiella, or the organisms which have been basically implicated. Whenever primary hyperparathyroidism is suspected, what is it due to? Parathyroid adenoma. So to evaluate that, you should do serum calcium, not necessary to do 24-hour urinary calcium, is what you need to identify. Then coming to the anatomy of the colon and rectum, the ascending and descending colons, they are usually fixed to the retroperitoneum, is what you need to basically remember. So you must know which part of the colon is intraperitoneal, which parts of it is extraperitoneal, so also the duodenum. So all that finer aspects of anatomy is commonly asked, surgical anatomy. Now cecal diverticulae versus that of sigmoid diverticulae, what is the main difference? Typically cecal diverticulae are congenital in origin, that is the reason they are true diverticulae. Whereas sigmoid diverticulae, they lack a muscular component, that is the reason they are not considered to be true diverticulae, is a way by which you can be able to differentiate. Colonoscopy, what are the main indications? Colonoscopy is for diagnosis, not to monitor the treatment in case of Crohn's colitis, is what you need to understand. Then colorectal polyps, hyperplastic are most common type of polyp, which is true, as all of you know. Then where do you see Artel's line? Trachoma, classically. Bilateral conjunctivitis in the hot weather makes you to think of vernal keratoconjunctivitis. Then a cricoid hook is for tracheostomy. In laryngeal papillomatosis is the indication for low tracheostomy, which has a risk of developing, leading to ventilatory failure. Then what is this fetal heart rate pattern? This is called late deceleration. Compare it with the muscular contraction of uterus. Where is it happening? It is not happening immediately after the onset, but during the later part. So late deceleration is a sign of what? Fetal hypoxia is what need to be remembered. Then laparoscopic salpingostomy versus laparotomy with salpingectomy. What is the difference mainly? Mainly, if you do laparoscopic surgery, morning you did surgery, next day morning or today evening only patient can go home, is what need to be remembered. 30-year-old, 25th week presents to labor and delivery complaining of irregular uterine contractions and back pain. She has a vaginal discharge and she had a light vaginal bleeding and she is afebrile. So all can be done except what? You can't do digital exam, because unless proven otherwise, any bleeding during the third trimester is considered to be placenta previa. So that is the reason, unless you do ultrasound and confirm where is the location of the placenta, then you should not venture out in doing digital exam, is what need to be remembered. A 44-year-old presented to the district hospital with a bright red blood color her vagina earlier in the day. The bleeding occurred shortly after intercourse. Once more, don't wonder that 30 weeks gestation, how come intercourse? In India or any part of the world, for the couple, when they want to have intercourse is not in doctor's control, right? So that is the reason 30 week what? 38th week also it can happen, except intrapartum any other point of life, it can be pre-partum or post-partum. Immediately after post-partum also husband may be waiting to have an intercourse. So anything can happen. So, but the idea here is once more, last trimester of gestation. Whenever there is a bleeding, then perform ultrasound without venturing out into doing digital exam. Toxoplasmosis, what is the highest risk? Eating raw meat. Which part of the world do people eat raw meat? It's a part of their culture. French eat raw meat. They have a raw romantic love. They are too erotic. So they can also develop toxoplasmosis. You need to be quite sure. Then 38-year-old, the rash started on her abdomen. Where is the rash located? That is important. Along the point of the stretch marks, the rash is present. So rash in the stretch mark area is the classical story of PUP. What is PUP? Pruritic urticarial plaques and papules of pregnancy. It is the most common dermatological condition of the pregnancy of all different causes of papular eruptions. And it is more common in nulliparous, it is more often in the second and third trimester is what you need to remember. Is a very, very important point of focus. How to differentiate it from the other causes, I leave the literature for you. Because the other causes, when will they occur, where will they occur, location of occurrence, they all differ. Right? Then 37-year-old at 10 weeks of gestation, history of Graves' disease, maintained on propylthiouracil. Propylthiouracil can cross the placenta and can lead to fetal hypothyroidism. Can very much happen. So there is a reason infants can develop fetal hypothyroidism if the mom is taking propylthiouracil. 41-year-old Jeevan P. Giro at 39 weeks typically had a outlet forceps. Which one among these is fundamentally an outlet forceps? If you look at the Simpson's forceps, it can be used low or outlet forceps deliveries. Cleland, where will you use? Mid forceps. And mid forceps में you can do rotation. OP को OA कर सकते, OA को OP कर सकते. Hospital anterior, hospital posterior. पूरा steering मारने के लिए Cleland better है. But already baby almost came like a telegram coming out and you are just receiving the courier packet of Flipkart. इसके लिए Simpson outlet. And Piper is for what? It is for delivery of the after coming head during the breech delivery. That is baby's legs, abdomen, belly, everything is born, but head is अटक गया maternal pelvis में. तो Piper लगा के खींचने के लिए. So before taking gynops, be very sure, are you good in the rope pulling game or not? Are you prepared mentally for a rope pulling game every day or not? Then join. Otherwise, you have to use a rope to hang. Because if your plan is to do dermatology means maximum 3 baje, 4 baje ko kaam khatam. Evening 4:30 or so, your software engineer husband will come and both of you will be going in a car having a little shopping. Obstetrics means exactly when you want to have candlelit dinner, that time only amniotic fluid will rupture and you have to be there on the side of the patient, not the side of your husband. So two people will cry. One is the newborn baby whom you are attending, other is your fiancé. That you are not available for the minimal carnival pleasures of life with him. So then 25-year-old Jeevan P. Giro, 41 weeks. There is a rupture of membranes, painful uterine contractions every 2 to 3 minutes. Fetus is 3.2 kgs. Then what is the best method that you want to basically do in this given scenario, right? And fetal heart rate tracing is reactive. So the fetus is in a double footling breech and which itself is an indication for cesarean. is the point you need to appreciate in this question. What can arise from cranial tumors or hypothyroidism? There is a development of a true sexual precocity. True sexual precocity का मतलब क्या होता है? Fundamentally, every newborn girl has got a pituitary, has got an ovary and capability to ovulate. But what stops the ovulation from occurring until she matures at 10th or 11th year of her life? Pituitary is blocked from releasing the releasing hormones, LH, FSH. But if the pituitary, hypothalamus lead to a premature release of LH, FSH, and that is leading to ovulation occurring before 8 years of age if the puberty begins. That is called true sexual precocity, is what you need to basically remember. Okay, so I'll leave the literature for you. Then 32-year-old, over the past 9 months she had 2 dilatation curetages and she has got dysmenorrhea, which is not relieved by taking antiprostaglandins and oral contraceptives. So, what is the most appropriate thing that you want to? Oh, she has got increased heavy menses, not dysmenorrhea, menorrhagia. So, what is the important thing you want to do if it is not relieved by giving OCPs? You should ideally do a hysteroscopy and look for whether there are any endometrial polyps, any small fibroid, what is happening in the ground level in the endometrium. You have to evaluate by doing hysteroscopy is what need to be remembered. So why danazole is given in management of endometriosis? Danazole, because of its androgenic properties, will lead to endometrial atrophy, for which we give the danazole. Hysteroscopy was done in a 32-year-old female, and what is it showing? Lot of adhesions. So how do they basically present? Asherman syndrome, typical hysteroscopic appearance of multiple endometrial adhesions. How do you expect endometrial adhesions to look like? Anytime you attended a laparoscopy session, it's like flying in the clouds and looking through the window of the aeroplane. You are having a lot of fluffy clouds watching through the window of the aeroplane, right? So like that you are having all these adhesions. So they present with hypomenorrhea as the presenting feature. A 42-year-old woman who had 2 normal pregnancies, amenorrhea for 7 months, you have ruled out pregnancy. Then what is the next important thing that you need to do to evaluate amenorrhea? LH and FSH levels is what you need to evaluate. Don't forget, doctor, out of 30 questions, 1 question compulsory from infertility. Infertility के बिना entrance नहीं रहता. After this much of stress for MBBS seat, MD seat, our pituitary, our entire reproductive machinery will be overburdened by high yield facts, topics. So we may become a topper in entrance, but ultimately end up to become a spermogenic PG topper. So that's the reason infertility is a very, very important topic. What are the WHO standards of semen quality? Normal volume, how many will be dancing with their tails wagging among the sperms? What percentage motile sperms is normal, abnormal, 30 hai, 20 hai, 10 hai? Examiner will rough you down with the infertility questions. So be sure to review that. 19-year-old becomes sexually active, recently became and seen on severe primary dysmenorrhea. In spite of using heating pads, analgesics, nothing helped. Then what do you want to do? That's an indication for OCP for dysmenorrhea is what need to be remembered. Now the hystosalpingogram in a 32-year-old who is presenting with infertility has been presented to you. This is a classical appearance of salpingitis systemica nodosa is what need to be remembered. Then what is the most appropriate day of a 28-day cycle where you want to know the serum progesterone to document ovulation? If the ovulation happen, what happens to the progesterone? Ovulation 14th day, who are doctor? Right? So corpus luteum will be the main source of production of progesterone. It should produce adequate progesterone by 21st day. Then only what will happen? 14th day ovulation, ovum released, standing on the platform, sperm proposed, they both met together, fertilized, went to father-in-law's house, mother-in-law's house. Where is mother-in-law's house? Endometrium. By that time, progesterone should be produced by that what? Graafian follicle, corpus luteum, which release that ovum. You should produce progesterone that will go and keep the endometrium ready, so that the boy and girl marrying come to the new home and do a home warming session in the endometrium. So that is the plan. And what can lead to infertility or a misconception? Thus, ovum released, boy met, both are ready, but when they came, apartment is not ready. Right? The endometrium is not ready. That can happen. So, doctor, management of infertility is an art. You should be a good endocrinologist, good embryologist, good anatomist, good, need not be good gynecologist. You need not be cutting gynecologist. At least if you are an intelligent gynecologist, if the woman become pregnant, you should not end up in laughing, oh, after 100 women, at least one woman became pregnant. You should not do that. And if the woman did not become pregnant, you should not cry sitting along with her, that, oh, why this happened to you and to me. You should not say that. You should be equally balanced and manage the patients and their attendance expectations. Anyway, after you join MD, we will train you on that also. So, day 21. Now, a 22-year-old reports menses started at age 13 and have been irregular, and she has got a typical lesion on the skin. So, what is the possibility that can happen? She has got fundamentally acne with hirsutism. Now, acne with hirsutism, but the point is, her biochemical investigations, are they being given? There is no galactorrhea, thyromegaly, temporal balding. Temporal balding is there? No. Then possibility of differential diagnosis may, any of these can be there, but why it is not certainly Leydig cell tumor? What is the age? 22 years, no? I think all the four are a possibility, right? So, but if it is certainly Leydig tumor, clitoromegaly and other features can also be there. Temporal balding also will be there because the virilizing effect. In her it is not there. So, that rules it out. Then which effect will estrogen will have? It will increase the HDL, protect the heart from getting heart attack. So, all women who are premenopausal have a superior nature. They can make men to get heart attack without by themselves getting a heart attack because of the high HDL offered by estrogen. Postmenopausal, all are equal, right? So, that is the point. So, doctor, are you all hungry? If you still want to finish remaining questions, we will do, or otherwise we will call it a day. We will call it a day. Day after tomorrow, I am leaving So I am also in a rush of packing few things. So thanks for the patient listening, and next Sunday I will not be there to discuss the paper. We have the question paper, very good question paper. Discussion will not be there next week, but after that Sunday we will have, right? And from the month of November first week onwards, we will have weekly 2 tests, Sunday, Wednesday, Sunday, Wednesday. So it will give you more opportunity to practice, right? So thank you very much.